come on in. I'm just pulling your chart up here real quick. Making sure that we have everything information-wise. Okay, looks like I gotcha. Can I just have you verify for me your name and date of birth? Perfect, okay. So it looks like we have you here today because you've been dealing with some chronic ear infections, yeah? Okay, I'm sorry to hear that. How long has that been going on? Oh, wow, okay. Do you currently have an ear infection? Okay. Any diminished hearing? How about ringing in the ears? Okay. Any dizziness or loss of balance, vertigo? Any ear pain or pressure? How about postnasal drip or any sore throat? When you go on an airplane, do you have a hard time relieving the pressure from your ears? Do you swim frequently? Okay, and then last question, when you've been in the shower, gone swimming, taken a bath, have you ever had an instance of getting water in the ear that you were having a hard time clearing? Okay. That is all of the questions I have for right now. So, today we're going to be doing a series of different tests with you, okay? We're going to be doing some hearing tests, and we're going to also be using some equipment that's going to look deep inside of your ears and let me know if there's fluid present, if there's any issue with the internal muscles that basically contract and relay information between the ears and the brainstem, or any kind of abnormalities that might be playing a part into the chronic ear infections that you're experiencing, okay? Okay, so first thing I'd like to do is a nystagmus test. It's where I turn your head from side to side while watching your eyes, making sure that I don't see something called nystagmus, which is a flickering in the eyes that occurs when we feel a loss of balance, okay? So, do you have a delicate neck at all? Okay. So what I'm going to do is I'm going to place my hands on either side of your head, and I'm going to turn your head from side to side. Okay? Okay. So, to start, just a small movement, just like that. Is that okay? Okay. I'm going to make it a little bit bigger. And got some intense eye contact here because I don't want to miss it, even if there's a subtle flicker. Okay, back to me. Any dizziness there? Okay. Okay, good. Check your eyes real quick. Have you focus your gaze right here between my eyebrows. Good. Excellent. All right. Sounds like we got a low-flying plane happening overhead. it's been pretty busy in terms of planes this weekend. And I think it's probably because we're getting close to summer. Alright, I'm going to take a look inside of your ears, okay? Let me know if this is uncomfortable or tender at all. Just looking to see if I can visualize any presence of fluid in the ear, any redness or inflammation, or any abnormalities to the internal structures. But everything looks intact. There's just a bit of serum in here, which we're going to do a little cleanup in just a moment. Check the other side. Okay. Any pain or discomfort here? Okay. Please let me know if that changes. It's helpful information. Not seeing any redness or inflammation on this side. No fluid that I'm able to see. Your tympanic membrane appears intact, which is good. So, okay. I'm gonna do a quick cleaning. Because I'm able to see the presence of some serum inside the ear or earwax. And it's going to potentially throw off the results because one of the things we're trying to discover today is if you have fluid inside of the ears. And one of the ways that we determine that is by whether or not your eardrums vibrate. If they don't, it can indicate that there is some fluid trapped behind the eardrum, which is preventing it from doing so. But I want to make sure that we're able to discern that the reason why it's not vibrating is because of fluid, not because of wax. Okay? Okay. So. I'm going to do a quick clean. I'm not going to go too in depth here because we don't need to remove all of it. Just enough so that way we don't get any false positives. That's okay. A little tickly, that's okay. As long as it's not painful. Much better. All right. Keep that right there, actually. And let's take care of the other side. Okay. Let's check this side now. Much better. Okay. So, let's turn this off. Now I'm going to take a look with a different otoscope. And this one has a little bulb attachment which allows me to blow a little puff of air, okay? Shouldn't be painful, just a little bit of pressure. It's probably going to tickle. If that's the case, I apologize. But this is going to let me see if, in fact, the eardrum is able to vibrate. So, here it comes. Alright, now we're going to check the other side. So, okay. So I am seeing vibration of the tympanic membrane, which is good. But I would like to rule out the presence of there being fluid more deeply within the ear. So let me just take a couple notes here. So now we're going to do a series of testing consisting of hearing test, tympanometry, and acoustic reflex test. The latter two both involving my machine right here. If these tests are not conclusive, then I will be sending you over to our radiology department to have imaging done of the ears, so that way we're able to see more deeply inside of what's going on. Okay? Okay. So the first one we're going to do is one you're probably pretty familiar with, which is the good old-fashioned beep test. So I'm going to be placing these headphones. Get that off of you. There we go. I'm going to be placing these headphones over your ears, okay? And they are noise isolating, so it's going to diminish mostly other noises around you. So, place these over you like so. And let's adjust these slightly. Should be more comfortable. Comfortable? Okay. So it just takes a moment to load. So, there's going to be a series of tones that you're going to hear. Are you able to hear me okay? Okay. So when you hear a tone, I would like you to raise your hand in the corresponding side of which you hear that tone, okay? Okay. So beginning now. Okay. That should be all of it. So go ahead and take these off of you. Alright. How was that? Did you feel like you were able to hear all of the tones equally well, or any in particular difficult? Some of the lower register ones? Yeah, okay. Most people struggle with those. Okay. So now what we're going to do is something called tympanometry. Let me turn on my program here. And we'll start with your left. Okay, so for this one, for both of them, but for this one, we have this little probe here. And if you hold it up really, really closely, you may or may not be able to hear it without it being in your ear. There's a very low level tone that plays. It's going to play the entire time, but what you're going to notice is throughout the test, you're going to feel different kinds of air pressure moving into the ear. So it's going to change the intensity, and sometimes it'll be negative pressure. And we're trying to see, based on that, how well your tympanic membranes, your eardrums, move in response. So if they're stiff, or if they are painful, or just not moving, that can indicate to me that there is fluid behind the eardrum that I'm just not able to see with my otoscope, that this is able to detect. Okay? So, just start on this end. This should not be painful. It should just feel like pressure, right? Kind of like that feeling when you're taking off in an airplane and your ears haven't quite popped yet. It's a little bit akin to that. If it gets to a point of being painful, please let me know though, alright? Okay, so we're going to begin. Just lightly press it here. So here comes that low level pressure. A little increase. Doing great. A little more. And now negative pressure. That pressure should be gone now. Okay, and we're going to do the other ear. So back here. Okay, should be starting. Okay. So here comes a little bit of pressure. A little bit more. You doing okay? Bit more. So now negative pressure. we're going to do our acoustic reflex testing. And this one is basically measuring the contractions of your inner ear muscles, or your middle ear muscles rather, the stapedial muscles. And it's basically making sure that your ears and your brainstem are communicating. So I'm going to be putting some electrodes on you, and I'm going to clean just a little bit because it's really common for us to have some oils on the skin around our ears. But the problem with that is that it can interfere with the ability to get a good connection with my electrodes. Okay. So the Audiologist does me the favor of helping it stick a little better. So this is going to go kind of in the place where your if you had a cochlear implant, where that would go. And we're going to put one more on here, provided it doesn't get stuck to my finger. Alright. Now it shouldn't be difficult to remove, but if it is, we have some tricks here for getting it to come off pretty smoothly. Because we are definitely aware that certain people have sensitive skin. So we try to be as accommodating as we can. Okay. I'm just going to take these wires and put them in right here. Okay. Sorry, this program is a little bit slow to load sometimes. There we go. Okay. So I'm going to be using this probe again, okay? So this time there will not be that air pressure. It's just going to be kind of going in inside of your ear, and you should hear a tone. Okay. One more frequency here. Good. And you might hear my machine here making some different noises. Okay, so now we're going to do this side, okay? So again, feel the pressure. I'm going to move to 500 decibels. $1,000. Okay. And one more. Okay. Okay. Well, my printout's showing a negative result here. Looks like we had positive contractions. So your neuronal pathways are intact there. Okay. So really quickly, I'm going to do one more exam. I'm going to be taking a look at the external auditory structures, so the cartilage, as well as the region in front of the ears, which is where your parotid and lymph nodes can show up if they're inflamed. Just looking to see if there's any sort of external abnormalities that may be playing a part. And actually, let's get these off really quickly. Okay. I'll take care of that later. It's okay. Please let me know if anywhere that I touch causes any discomfort. It's very useful information. I'm starting in the area where your parotid lymph nodes would be present. Behind a bit to where we would feel occipital nodes if there were some. And following under your jaw, your mandible. I'm going to press on your sinuses just a little. here. Okay. And one more thing I want to do. Let's take one last look inside of your ear. After we've blown a bunch of tones in there, and see how the internal structures responded. For example, if it produced an excessive amount of wax in response to the vibration of your eardrums. Because that's how that wax tends to be produced, is in response to vibration. It's what our eardrums do in response to noise. They vibrate. Some people are more sensitive. Okay. Check the other side. Not seeing anything abnormal on this side either. Everything seems to be nice and balanced. Okay. And then really quickly, just want to check your throat for any drainage, just in case we shook anything loose. Yep, open. Perfect. But I'm not seeing anything. So, okay. Didn't feel any lymph nodes. No sinus inflammation. Your external ears look good. I'm not seeing anything abnormal there. They're nice and symmetrical. So, what I would like to do is write an order for radiology to do a head CT with and without contrast. Do you have any allergies to iodine, shellfish? Okay. Have you ever had a scan done with contrast in the past? Okay. Did you have any reaction? Okay. Good. So what we're going to do is have you do a head CT with a focus on the auditory canal. That should hopefully let us see more clearly if there is fluid or inflammation or something else present deeper within the ear that I'm just not able to see on exam in my clinic. Unfortunately, the otoscopes only allow us to see so deeply, and this only can really help us see so deeply, so sometimes we need to have radiology come in and give us a hand. I would like you to get this done today, and let me just look in the system really quickly and see what the queue is like. Okay, so it looks like there's only one person down there, so let me just get an order in so that way we can hold the next spot. And I'm going to set this so that you do not need to wait for the radiologist to interpret the scans. I will have them interpret, and then I'll discuss the findings with the radiologist, and after I do that, I will give you a call, so that way we can discuss next steps and any further recommendations or treatment plans from there. Okay? Okay. Don't worry. I'm going to make sure that we get you a diagnosis, because I know how frustrating it is to have a chronic issue that you just really can't get relief or answers for. So we're going to make sure that we get that for you, because everybody deserves to have that peace of mind. Let me just check and make sure if your insurance requires prior authorization. And it looks like it doesn't, so that's good. Okay. So then I have a phone number in your chart ending in 7264. Is that the number you'd like me to call you to discuss the results? Okay. Is it okay with you if I leave a message? I won't leave any medical information. Okay. I figured it was a cell phone, but just wanted to be sure. The only thing I would leave on your voicemail if you don't answer is just that it's Dr. Cozy, here's my number, can you please call me back? That's it. Just making sure that there's nothing else we need here. Okay, looks like we're good. So, alright, I'm gonna go ahead and lead you down there, okay? It's right on the way out, but it's kind of tucked back, so it's a little bit difficult to see if you're not trained to look for it. So, are you ready? Okay. Come right with me then.